It's a simple question. Do you believe that alcohol is a leading preventable cause of death, disability, injuries, accidents, and social problems?
I believe that abuse of alcohol consumption can be detrimental to one's health.
Wow, okay, I can see the game you want to play today, which is very sad on behalf of Canadians, Minister.
Everyone has an opinion about Canadian federal politics.
Oh, yeah. Dr. Ellis, please, for 5 minutes.
Thank you very much, Chair. Thanks, Minister, for being here. There's a statement, alcohol is a leading preventable cause of death, disability, injuries, accidents, and social problems. Do you believe that, Minister, to be true?
I think that alcohol is a substance that unfortunately is used by too many across this country without an understanding of what the health impacts of it are. We continue to do that work in prevention and education through the Public Health Agency
Minister,
of Canada.
I'm not asking you some trap question here. That's from the Canadian Guidance on Alcohol and Health, the final report. It's a simple question. Do you believe that alcohol is a leading preventable cause of death, disability, injuries, accidents, and social problems?
I believe that abuse of alcohol consumption can be detrimental to one's health.
Wow, okay, I can see the game you want to play today, which is very sad on behalf of Canadians, Minister. You know, the other thing that's incredibly sad is that your government put forward a temporary tax trick on Canadians, which included removing temporarily for 2 months the GST on beer, wine, and ready-to-drink alcoholic drinks. How did that make you feel, Minister, when that came across your desk?
The GST tax break for Canadians was meant to address and does address affordability concerns that many Canadians across the country have shared with us. And in responding to that and listening to Canadians, particularly during the holiday season, we wanted to ensure that they were able to have a break during this time in the holiday season when they're gathering to celebrate.
But Minister, your government is promoting, by reducing the price, consumption of alcohol. Is that not true?
The GST tax break is for Canadians to make the choice of what goods they wish to purchase to enhance their holiday season.
I guess what I would say to you, though, Minister, the member from Canada Carleton made an interesting video quite clearly encouraging Canadians to drink alcohol, showcasing a bottle of wine. Is that not true?
I do believe the leader of the opposition has been in multiple videos grabbing a beer with folks and promoting it as well. So
Minister,
I'm not really sure what the point
Minister,
of your question is,
one of the most effective
Chair.
ways we have to help Canadians, is it not true that, again, well, why didn't you include cigarettes in that? Why did you not reduce the taxes on them? Why would you, as a member who represents mental health and addictions in the failing government, think that that's a good idea on behalf of Canadians to reduce the GST on beer, wine, and ready-to-drink alcoholic drinks? Explain that to Canadians. It's a simple question.
Through you, Chair, I believe I've answered the question with regards to the GST tax break for Canadians in addressing needs of affordability. Our Office of the Mental Health and Addictions, as well as Associate Minister of Health, is to ensure that we provide resources for prevention and so that Canadians can make healthy choices no matter what they eat or consume.
But Minister,
and this is the work that we do at the federal government.
If I might, did your department have any input into this policy? Did you know this was going to happen, or did they do it behind your back?
The GST tax holiday for Canadians is to address affordability.
That's not what I asked you. I said, did your department, as Mental Health and Addictions, have any input into the temporary tax trick, or did they do it behind your back?
As the member well knows, cabinet confidence is that, and the decision was to provide a tax holiday to Canadians.
So clearly, on behalf of Canadians, you would like to see them drinking more alcohol. That being said, Minister, what about the other parts of the temporary tax trick? We know that Canadians are having a difficulty affording food. Your government supported a private member's bill, C-252, that actually wanted to reduce advertising to kids, and now you're out there saying that children, it's okay because we've reduced the taxes on it. You should eat chips and candy and coated popcorn and curls and twists, etc. Is that something, again, inside your portfolio that you agree with, Minister? Yes or no? It's not a difficult question.
So through you, Chair, it seems now that Conservatives seem to think that the taxes perhaps good, or that we should be evaluating this as public policy and how it relates to the price on pollution. I'm not really sure
I
where
guess, Minister, what
conservatives
I'm asking
stand
you to
on
do,
ensuring
which-
Chair, I do believe
Minister,
that I
excuse
have the
me,
floor.
I'm just going to interrupt you there.
I do believe I
You know,
have the floor,
I think
Chair.
the big thing is, Chair, is that,
Minister, there's about 10 seconds left in this round, so make your
Yeah.
point.
I guess the question is, Minister, is why would you, as the Minister for Mental Health Addictions, support encouraging Canadians with unhealthy behavior? Sadly, Minister, that's your job. Sadly, it appears you don't know that.
Take 15 seconds to respond, Minister, please.
Sadly, Conservatives don't seem to believe that Canadians should have a tax break. So again, outrage is big but weak on action. Thank you, Chair.
Ms. Kayabaga, please, for 5 minutes.
I just don't think we should encourage
Thank you,
Canadians to drink it.
Chair, through you.
Everyone has an opinion about Canadian federal politics.